So, magandang gabi po sa ating lahat. Welcome ulit sa isa na namang episode ng Open Arms. And tonight will be a little more special dahil ang ating topic ngayon ay kung paano natin maaagapan ng coronavirus disease 2019, COVID-19. Dahil as we all know, ang cases ng COVID-19 dito sa Philippines ay umabot na sa 35. Later on in this episode, itatalakay ko po ang mga paraan, mga preventive measures kung paano po ito maiwasan ang pag-spread at kung paano tayo mananatiling healthy and all. So, atin na umpisahan. Ngayon po ay ang ating Open Arms Special Report entitled Coronavirus Disease 2019 Outbreak Special Report. Ang una nating i-discuss ay kung ano ang isang novel coronavirus. Ito ay isang new strain of coronavirus. It was first identified in Wuhan, China, na ang official moniker ay Coronavirus Disease 2019 COVID-19. Co stands for corona, V stands for virus, and D stands for disease. This was previously referred to as 2019 novel coronavirus or 2019 nCoV. It was a new virus na nauugnay sa same family of viruses as severe acute respiratory syndrome or SARS and some types of common cold. Paano kumakalat ang COVID-19? How does it spread? It's transmitted through direct contact with respiratory droplets of an infected person. This is generated sa pamamagitan ng pag-uubo o pagbabahing, coughing and sneezing, and touching surfaces na na-contaminate ng virus. The COVID-19 virus may survive on surfaces for several hours, but pwede itong mapatay ng mga simple disinfectants kagaya ng rubbing alcohol. Now, let's talk about symptoms of COVID-19. According to the World Health Organization, ang mga symptoms ng COVID-19 ay fever, lagnat, tiredness or pagkapagod, and dry cough. Some patients may have aches and pains, nasal congestion, runny nose, sore throat, or diarrhea. As of today, this is the last count. This new respiratory disease has left 3,800 dead and naka-affect na ito sa approximately 110,000 worldwide. In more severe cases, ang infection ay nakakasanhi ng pneumonia or breathing difficulties or hirap sa paghinga. More rarely, the disease can be fatal. Ang mga symptoms na ito ay similar sa flu or influenza o kaya common cold na mas common pa kaysa sa COVID-19. This is why required mag-test upang ma-confirm na kung may nagdadala ng COVID-19. It's important also to remember that key prevention measures are the same. First, frequent hand washing, and then respiratory hygiene. Kapag tayo inuubo or sinisipon, we can cover our mouth with a flex elbow or tissue. Tapos, itatapon yung pinag-ubuhan or pinagbahinga na tissue sa isang closed bin or basurahan. Dahil meron ding vaccine sa flu, we have to keep ourselves up to date with vaccinations. That's also important. In our country, Philippines, meron akong um, 33 cases as of last count kanina. This diagram is part of the cases recorded before March 10, 2020. There are 100,000 COVID-19 cases worldwide. As of Monday, according to a tally by Agence France Presse. Am I pronouncing it right? Say I learned French and I cannot remember some French words. After a month of having no additional confirmed cases, the Philippines recorded several new cases in a span of 4 days. So these diagrams are the first 20 cases of COVID-19 in the Philippines. Here we will discuss the list of the first 20 cases so far of COVID-19. The first was announced on January 30, 2020. She was a 38 years old female Chinese national who traveled from Wuhan, China to Hong Kong and then to Cebu, Dumaguete, and Manila. She was then confined at the San Lazaro Hospital dahil sa mild cough. She was discharged from that hospital noong February 10. Her partner, a 44-year-old male Chinese national, was recorded as the second case of COVID-19 in the Philippines. He traveled to the same places as PH1 and was confined at the San Lazaro Hospital on January 25 dahil sa pneumonia. On February 2, he died and therefore he was the first COVID-19 fatality outside of China. It was only on Feb 3 after niya namatay nung na-announce na formally ang kanyang case sa pagkakaroon ng COVID-19. The third case described a 60-year-old female Chinese national. She was also a tourist from Wuhan, China like the first two cases. This time, she traveled to Cebu and then Bohol. Pagkatapos, na-admit siya sa hospital nung nagkasakit na siya by January 22. Then, she was transferred to St. Luke's Medical Center in BGC Taguig. Then, discharged on January 31. Philippine authorities were not aware that she was positive for COVID-19 dahil nag-negative naman ang kanyang samples. However, yung initial sample taken from her nag-positive dahil late nang na-test. Pag-uwi lang niya sa China, saka lang na-announce ang pagiging third case ng COVID-19 by February 5. So, ang fourth case ng COVID-19 ay ang unang Filipino na recorded. He traveled from Japan at dumating sa Pilipinas on Feb 25. This was the employee of Deloitte. Please comment if you know the correct pronunciation. It's located in BGC Taguig City as well. The man experienced fever and chills at na-confined sa St. Luke's Medical Center also in BGC Taguig. Afterwards, na-transfer siya sa RITM or Research Institute for Tropical Medicine, Muntinlupa City. PH5 was announced on March 6. He was 62 years old, male from Cainta, Rizal. Madalas siya sa prayer hall sa San Juan City at na-confine sa Cardinal Santos Medical Center after showing signs of cough. Pagkatapos, he was transferred to RITM at tsaka sa isa pang hospital dahil naging critical na ang condition niya. Nagsuffer siya from pneumonia, diabetes, hypertension, and an acute kidney injury. This patient is the first local transmission case in the Philippines because he does not have any travel history. Now, let's move on to the sixth case. She's 59 years old, Filipina. Siya naman ay asawa ni patient number 5. Na-confine din siya sa RITM after maka-experience ng mild respiratory symptoms. Case number 7 is a contact of a Taiwanese male na nag-positive sa COVID-19 pagkatapos dumalaw sa Philippines. This contact is a 38-year-old Taiwanese man na nasa Philippines na nag-positive din sa disease. He was confined at Makati Med nang magpakita na siya ng symptoms ng COVID-19 last March 3. This patient doesn't have any recent travel outside the country. He is among the 4 cases announced by DOH, Department of Health, last March 8. PH8 is the 8th case, 32 years old male Filipino na nakapagbiyahe sa Japan. He showed symptoms last March 5 and na-confine siya sa St. Luke's sa BGC. Another announced case last March 8 refers to an 86-year-old American male na nakapag-travel recently sa US and South Korea. These countries also have COVID-19 cases. He first showed symptoms last March 1 and was confined at Medical City in Ortigas. PH10 refers to the 10th case, a 57-year-old Filipino male from QC. This man has no history of travel outside the country. According to DOH, he was reported to have had contact with a confirmed COVID-19 case. As of now, however, under investigation pa po ito. Naka-confine na siya sa St. Luke's Medical Center sa QC naman. It was kahapon lang, March 9, meron pang 10 cases announced of COVID-19. Ang pang-11th ay isang 72-year-old Filipino male na walang travel history. Naka-experience siya ng ubo and confined na sa Ortigas sa Medical City. Another case refers to a 56-year-old male Filipino na naka-travel naman sa United Arab Emirates. He experienced fever and cough beginning in February 29. This patient is confined at Makati Med. Case number 13 is another male Filipino, 34 years old. He traveled from Australia and also showed symptoms of fever beginning in February 29. Naka-confine na siya sa Makati Med also. The 14th case refers to another male, 46 years old Filipino, na naka-experience naman ng fever and cough mula nung Feb 25 pa. This patient did not have any recent travel outside the country. Then the 15th case is another male, he's just 24 years old, na-admit siya sa Makati Med when he had cough symptoms last March 1. It is still unclear, hindi pa malinaw kung itong patient ay nakapag-travel na outside the country. The case number 16 had exposure with a confirmed case of COVID-19. This patient is a 70-year-old, 70 as in 70, Filipino male na inuubo na, nagka-sore throat at sinipon mula noong March 1. He is currently confined sa UniHealth Paranaque Hospital. The 17th case is a 69-year-old Filipina na may exposure sa isang COVID-19 case. Hindi pa malinaw kung may relation siya if she is related to patient 16. She experienced cough and colds last March 1. The 18th case is a 41-year-old Filipino male who traveled recently to Taiwan na nilagnat, nagka-headache at quote-unquote body malaise starting Feb 26. He is confined at Tri-City Medical Center, Pasig City. Sorry, I almost thought it's Trinity. Tri-City pala. Case number 19 is a Filipina, 46 years old. She did not have travel history but is also confined at the Tri-City Medical Center. In its data form, DOH had stated na under investigation pa ang symptoms ng patient na to. The last of the first 20 cases confirmed as of March 9, 2020 refers to a 48-year-old male Filipino who traveled recently to Japan. Naka-experience siya ng cough and body malaise starting Feb 29 at naka-confine na sa RITM. By 6 p.m. today, March 10, DOH has announced 11 more cases. I'm sorry, 9 lang pala. It has since been corrected of COVID-19. Kaya 33 na yung total recorded cases sa Philippines. The number started increasing on Sunday when DOH announced 3 new cases from only 3 since early February. 4 more cases followed on Monday and 9 more on Tuesday. Most of the cases announced before Tuesday are in Metro Manila. Maaaring maging fatal ang COVID-19 para sa elderly, the immunocompromised, pati na rin ang may mga underlying medical condition. Gayunman, 80% of global cases show the high chance of recovery. Thanks Roylan sa pag-correct. It is 33. High chance of recovery without needing special treatment according to World Health Organization. In a Facebook post just before 3 p.m., there was an initial statement from DOH na 11 additional cases of the new coronavirus in the Philippines. In a press conference last at 4:30 p.m. today, Assistant Health Secretary Maria Rosario Vergere, however, said that 33 lang talaga ang total number of confirmed COVID-19 cases. Dahil ang 11 na reported na bagong cases today ay naka-include ng 2 repeat tests. Sinabi niya na there were 9 new cases and 2 were repeats for patients 7 and 8. Vergere said that the DOH would like to apologize for that mistake dahil earlier than that time, may post na nanggaling sa health emergency meeting coming from World Health Organization wherein they initially reported the 35 cases. After na verify na nagtatry nilang mag-analyze ng numbers and correlate it with the list of patients na meron na sila, they found that the number that was initially reported for us were the number of samples referring to the 11. After that, na-take down na ang Facebook post announcing 35 cases. Dagdag pa ni Vergere na 9 new cases lang ang meron, hindi 11. Siyam lang, kaya ang total ng cases of COVID-19 ay 33 na as of today. Nasabi rin earlier ng DOH that it has deployed additional surveillance teams to conduct contact tracing. Contacts who need to be interviewed are those who lived or traveled with the positive cases. As of Tuesday, the agency's nCoV Tracker website lists 44 patients under investigation admitted to hospitals. May mga pasyenteng nagkaroon na ng symptoms ng respiratory illness and have traveled recently or were in contact with positive cases of COVID-19 na isang new strain of coronavirus na nag-umpisa sa China. Meanwhile, there are more than 80 Filipinos abroad na nag-test positive for COVID-19. Karamihan galing sa Diamond Princess cruise ship na nakadaong sa Japan. They have already recovered since. President Rodrigo Duterte said it was too early for the government to lock down Metro Manila dahil sa coronavirus outbreak dahil Philippines has not reached that kind of contamination. Duterte explained na ang local transmission ng disease ay hindi nag-justify ng regional lockdown citing economic losses. Nasabi na rin ni Health Secretary Francisco Duque III na maaaring maging premature pa to place Metro Manila on lockdown dahil sa virus threat even as the government sought to control the local transmission of the disease. Sorry about it. I nearly sneezed. Health authorities still have to wait for evidence of quote-unquote sustained community transmission bago mag-declare ng lockdown ng government. Ani Duque sa mga Malacanang reporters na sa Malacanang. Now, let's discuss on how to prevent COVID-19. Measures for protecting workers from exposure to and infection with the novel coronavirus, COVID-19. Excuse me. Depend on the type of work being performed and exposure risk. This includes potential for interaction with infectious people and contamination of the work environment. Dapat ding i-adapt ng mga employers ang infection control strategies na based sa isang thorough hazard assessment sa pamamagitan ng appropriate combinations of engineering and administrative controls, safe work practices, and personal protective equipment, PPE for short, to prevent worker exposures. This interim guidance has been developed by the U.S. Occupational Safety and Health Administration, or OSHA, to help prevent worker exposure to COVID-19. Here's the general guidance for workers and employers. For all workers, regardless of specific exposure risks, it's always a good practice to, firstly, frequently wash hands with soap and water for at least 20 seconds. Kung walang soap and running water sa workplace or anywhere, use an alcohol-based hand rub with at least 60% alcohol. Kapag visibly dirty ang ating kamay, always wash them with soap and water. Wag na wag hawakan ng mata, ilong, or mouth kapag hindi pa nahugasan ang mga kamay. Avoid close contact with people who are sick. Meron ding suggestions from researchers that individuals na meron ng medical conditions like diabetes and heart disease, pati na rin ng mga galing sa poor and densely populated areas, are more vulnerable or prone to the worst outcomes of the virus. For people with chronic respiratory disease such as chronic obstructive airways disease, infectious diseases like HIV and tuberculosis, chronic cardiovascular disease kagaya ng cardiomyopathy, previous myocardial infarction or atake sa puso, or rheumatic heart disease, pati cancer or autoimmune diseases, may recommendation si Professor Karen Sliwa, and experts from WHF, including Professor Friedrich Tienemann, Professor Yunbo or Junbo Ge, Professor Rick Graby, and Professor Fausto Pinto. Where is it? 1. Umiwas tayo sa mga large gatherings at mga matataong lugar or crowds as much as possible. Kailangan tayong lumayo ng 1 to 2 meters mula sa taong may respiratory symptoms. Don't stay in the same room with this person. Vulnerable people should be considered moving with relatives in rural areas and spend their time in voluntary isolation, kagaya ng isang small hut. Kailangan makatanggap siya ng food supplies mula sa isang kapitbahay or relative nang hindi magkaroon ng direct contact. Travel should be reduced to a minimum. Kailangan magsuot ng mask if traveling by bus, train, or plane. Kung walang masks or hindi makabili, pwede nang i-cover ang nose and mouth with a cloth or similar, kagaya ng panyo. Now, let's discuss the best way for proper hand washing. Marami tayo nakikita ganito in public places, by the way. The first step is to wet hands with running water. The second step is to apply enough soap to cover wet hands. Step 3 is to scrub all surfaces of the hands, including the back of hands, sa pagitan ng mga daliri and undernails for at least 20 seconds. Step 4 is banlawang mabuti with running water. Step 5 is dry hands with a clean cloth or single-use towel. It's imperative to wash hands often, especially before eating, after blowing your nose, coughing or sneezing, and going to the bathroom. Kung hindi naman available ang soap and water, this has been already discussed in a previous slide. Kailangan gumamit ng alcohol-based hand sanitizer containing at least 60% alcohol. Always wash hands with soap and water kung halatang may dumi sa kamay. Of course, hindi natin maiwasang may mga nagpapalaganap ng fake news or misinformation about COVID-19. UNICEF Philippines issued an advisory against viral posts using its name, which featured supposed facts on COVID-19 that the organization tagged as a form of quote-unquote misinformation. In a warning by Charlotte Petri-Gornitska, UNICEF Deputy Executive Director for Partnerships, it's dangerous and wrong to share the so-called inaccurate information on social media and misappropriate the names of organizations. Gornitska said that a recent erroneous online message circulating in several languages around the world and purporting or claiming to be a UNICEF communication appears to indicate, among other things, na kapag umiwas sa ice cream at ibang malalamig na food, pwede nitong ma-prevent ang onset ng disease. It's of course wholly or completely untrue. May mga screen grabs shared in UNICEF Philippines verified social media accounts ng mga viral posts from chat applications that used the organization's name and clarified it only releases information on its verified pages. Yung mga ganyan, if you've also received it, it's been made clear that they are not really from UNICEF. Always be mindful and check first with official UNICEF, WHO or World Health Organization, and DOH channels before sharing posts, UNICEF Philippines said. The organization urged the public to only check official websites when it comes to sharing information about the novel coronavirus. Nagbigay rin ito ng mga links sa article na Coronavirus Disease COVID-19, What Parents Should Know, and the webpage of World Health Organization dedicated to updates and information about the pathogen. Stay safe and inform everyone, UNICEF Philippines said as it shared the links. And of course, let's also say a prayer. Ang Oratio Imperata laban sa Coronavirus Disease 2019. Makapangyarihan at mapagmahal na Ama, lumalapit kami sa iyo sa aming pangangailangan upang hilingin ng proteksyon laban sa Coronavirus Disease 2019 na nagpapahirap sa marami at kumikitil ang mararaming buhay. Nagmamakaawa kami, mapagmahal na Ama. Nagabayan mo ang mga taong nag-aaral kung saan nanggaling at sanhi ng epidemyang ito at sa mabilis na pagkalat nito. Gabayan mo ang mga kamay at isipan ng mga eksperto sa medikal na maaari silang magdingkod sa mga may sakit na may kakayanan at pakikiramay. At sa mga gobyerno at pribadong ahensya ay silang dapat makapaghanap ng lunas at solusyon sa epidemyang ito. Iligtas mo kami sa lahat ng uri ng karamdaman. Pagalingin mo ang mga may sakit. At buhayin mo sa amin ang pagkakawang gawa upang kalingain namin ang bawat isa. Hinihiling namin ito sa pamamagitan ni Jesucristong anak mo na nabubuhay at naghahari kasama mo at ng Espiritu Santo. Iisang Diyos, magpasawalang hanggan. Amen. Mahal na Birhen, magpapagaling sa mga may sakit, ipanalangin mo kami. San Rafael ang Arkanghel, ipanalangin mo kami. San Roque, ipanalangin mo kami. Ina ng Kaligtasan, ipanalangin mo kami. San Lorenzo Ruiz, ipanalangin mo kami. San Pedro Calungsod, ipanalangin mo kami. At ito ho ang ating special episode tungkol sa novel coronavirus disease 2019 or COVID-19. Hanggat maaari, kailangan umiwas muna tayo sa matataong lugar. It's better na magmatsyag tayo at mag-monitor sa kung anong maaaring sintomas na ipapakita ng sino man na nasa paligid natin. Always maintain good hygiene. Kailangan laging maghugas ng kamay. And the best solution is prayers, and prayers. Mag-ingat po tayong lahat at muli po tayo magsasama sa isa pang episode ng Open Arms susunod na linggo. Ako ho si Millicent B. Macuse, naniniwala sa isang One Inclusion Nation. Magandang gabi po.